This week, I'm joined once again by Desiree. She is my social media manager, and we're going to talk all about hot topics in plastic surgery, the hot topics that were at the annual meeting of the Aesthetic Societies. We're going to talk about some celebrities who have made huge strides in plastic surgery. We're going to talk about some interesting facts and assertions. So there are these devices that have been around for many years that simulate breast augmentation. So obviously you take your top off and it has numerous cameras. And so I bought this device at the time, like I said, it was maybe 15, 18 years ago. And it was like $30-some thousand. Would you date somebody who uses urine as his skincare? It does create lines, but though because the actual color
actually have been supplementing
medicine and really looking at masters in medical aesthetics. It only takes 2 minutes a day and Well, welcome to the show. This week, I'm joined once again by Desiree. She is my social media manager. She is also an administrative assistant here at Youn Plastic Surgery. And we're going to talk all about hot topics in plastic surgery. We're going to start with the hot topics that were at the annual meeting of the Aesthetic Society. So this is one of the huge meetings amongst plastic surgeons. I didn't go to it. And we're going to talk about some celebrities who have made huge strides in plastic surgery as far as getting, publicity for it. And we're going to talk about some interesting facts and assertions. We're going to do a kind of like a myth-busting type of thing as well. Okay, so we're going to start first by saying hello to Desiree.
Hello, how are you?
How have you been?
Good.
Anything new going on in your life lately?
No, I'm excited to be back though.
So I think it's like jean jacket day because
Yep.
we're both wearing our jean jackets. Hers is probably more, stylish than mine. Because I used to have, when I grew up like in the 80s, and I used to have this Guess jean jacket that I loved growing up. And then it became like not cool. And it was like huge. It was an XL and everything. So and then just like a couple years ago, I'm like, I'm just going to get another jean jacket. And so then I've got
Looks
this.
nice.
And, yeah, but yours is probably more stylish than mine. But
I don't know about that.
all right, so we're going to start by talking about, so every year in plastic surgery, there are two huge annual meetings. The first one is the American Society of Plastic Surgeons. That is the society that's like all board certified plastic surgeons are pretty much in that society. And then there is the Aesthetic Society, which is composed just of cosmetic plastic surgeons. And so in order to become a member of that society, you have to be in practice for several years and you have to be primarily doing cosmetic work. And every year they have a big meeting. And this year it was in Vancouver. I did not go this year. My son's a senior in high school and I'm trying to limit the time that I am away. They were kind enough to ask me to present at a couple of different things at the meeting, and I turned them down because I wasn't going to be there. But there is an article in New Beauty magazine about some of the hot topics that were at the meeting, some of the hottest things going on in the field of plastic surgery. So I thought we would cover some of those just to give you an update on what's going on in the field of plastic surgery, and then we'll see what Desiree's thoughts are as more of a layperson working in a plastic surgery office, and I'll give you my insights into this stuff as well. So the first topic are GLP-1's role in plastic surgery. So I gave these topics to Desiree prior to this podcast.
Yes.
So let me just read this off and then we'll talk about it. GLP-1, initially developed for diabetes management, are gaining traction for their role in weight loss. However, rapid weight loss from these medications can lead to sagging skin, creating new challenges in the field of plastic surgery. According to Austin, Texas plastic surgeon Johnny Franco, MD, patients are now seeking solutions for sagging skin after losing significant weight with GLP-1s. We offer skin tightening procedures like Renuvion, Body Tight, and other surgical options to address this. So real quick, do you know what a GLP-1 is? I never told you what it was.
Aren't they like the injections that people give themselves, like semaglutide or whatever it's called?
Exactly. So semaglutide is the active ingredient in Ozempic. So everybody talks about Ozempic. Ozempic is obviously the brand name. That's actually the diabetes medication. So that's the one that's FDA approved for people who have diabetes to help them with that. But semaglutide is the active ingredient in it. So it's kind of like if you have Motrin and ibuprofen. So Motrin is like Ozempic, and ibuprofen, which is the ingredient, the kind of scientific name for it, would be like semaglutide.
Okay.
And so, what's going on is a lot of plastic surgeons are talking about how they're seeing now Ozempic face. Have you heard the term Ozempic face? Ozempic face then basically are people who have been on Ozempic, they've lost a lot of weight, and their face has changed. Have you seen any celebrities that they've talked about have had that?
I've heard of a couple, but I don't remember at the top of my head.
So some of the ones that they've talked about are Sharon Osbourne.
Okay.
And then there's that douchey guy from the Kardashians.
Scott
Disick. Yeah, that douchey guy.
Yeah, he looks sick. He looks ill.
And so, and then there's other celebrities, so they look like not healthy after having it done. But
they look like the corpse bride, like Tim Burton.
He does.
Yeah.
So his face so gaunt. And then there are other celebrities who've lost weight with Ozempic, and I think they look great. Like Oprah. Oprah has lost weight with Ozempic, and she looks really good. Was it Kelly Clarkson that just came out saying that she was on Ozempic or something?
I think she said it was like some form of it, but she was on something like that.
Yeah, and she looks great. Yeah, she looks great. So there are other medications, so Ozempic is like I said, is like the Motrin is the name brand. Semaglutide is the actual active ingredient. There's Wegovy, which if I remember right, that's the weight loss one that is FDA approved, but it's basically insurance doesn't cover it in general because it's for weight loss, not for diabetes. And then there are other medications like Mounjaro. I'm just blanking. There's a bunch of other medications, but they all kind of do the same thing. The idea is that they cause you not to feel hungry.
Yeah.
And so it exerts influence on your mind, but also exerts influence on your stomach, and it slows down gastric emptying. So like if you've got food in your stomach doesn't empty as quickly. Now this is important because if you're going to have plastic surgery and you're on Ozempic or Wegovy or any of these GLP-1 agonist weight loss medications, and you're going to have surgery, usually we say, hey, you need to stop eating like 8 hours before the surgery so that when you undergo the operation, you don't have food in your stomach. Because when you go under anesthesia, if you've got food in your stomach and you throw up, then that can cause major problems with breathing. Sometimes you can technically get what's called an aspiration, where you literally throw up the contents of your stomach into your mouth, and then you breathe it into your lungs. And that can be really dangerous if you think about it, like it's just a horrifying thought of getting actual food particles in your lungs. But that's what we worry about. And that's why if you undergo anesthesia, they tell you don't eat or drink anything like, after midnight or 8 hours beforehand, that type of thing. But if your stomach is not emptying as quickly and you follow those normal rules, and let's say you don't tell the doctor that you're on Ozempic, then what would normally be an empty stomach may not be. And so now what we're doing is we're having our patients stop those treatments a good 2 weeks before the operation so that their stomach is moving naturally. So anyways, that's kind of how these medications work. And so there's this idea that we're seeing Ozempic face. We're seeing now Ozempic butt. People are talking about Ozempic butt, which is basically you lose weight and your butt gets smaller. It's so stupid. And then there are doctors who are trying to like advertise this as marketing, like, hey, we treat Ozempic face and stuff. So it's kind of silly. So that's kind of the whole thing is plastic surgeons now, they're excited because it's just a whole new group of people that can pay them to have surgery done to either put fat in their face or to, get rid of saggy skin and stuff like that.
Tummy tucks.
Yeah, exactly. Tummy tucks and stuff. I know you answer a lot of the phones. Are you hearing people call who are saying anything like that or?
Actually, no.
Yeah.
I haven't. I've heard like the surgical scheduler deal with people like that, but I haven't had people ask about anything like that before.
And I think it's important to realize, and I've had journalists ask me, they're like, okay, how is Ozempic face different than like natural weight loss face or like Jenny Craig face or Weight Watchers face or keto diet face? And the answer is it's not different at all. Like you just lose weight.
Yeah.
And it's just somebody who's lost weight. So whether Scott Disick did it by going keto or by going on Ozempic, like it's going to be the same skeleton face he's going to have. He just, yeah. So I think that's important to realize. Another thing, one of the things I said too on my social media is you're seeing a lot of plastic surgeons who are advertising now these injections. And like I have colleagues of mine who are injecting this. What are your thoughts on plastic surgeons doing like Ozempic injections?
I mean, it's up to them, but I don't think it's the smartest thing to do. I feel like just because you're like a doctor doesn't mean I don't feel like you should be giving the injections. Because I know people who actually get it like through like their primary care physician. So it's like, I feel like if plastic surgeons do it, they're kind of like, hey, do this so I can do surgery on you so I can get the money and all that stuff.
Like
I feel like they're doing it for the wrong reasons.
I agree. The question is, what is the ulterior motive,
Yeah.
And if you really wanted to help people with weight loss, like why wouldn't you get like weight loss programs in your office to help them? Because it's a huge problem for people. The way I look at it, honestly, so many years ago, before you started working with me, so this would be something that you probably hadn't heard of, there was this trend towards gastric balloons. And these are these balloons that are basically, you swallow them empty, and then there's a string, like not a string, but like it's like a tube attached to it. You swallow this balloon, and then they fill it up when it's in your stomach. And the idea is that the balloon expands and it takes up space in your stomach. And because it takes up space, you eat less food because you're not as hungry, because your stomach fills up quicker.
Yeah.
And so they advertised these to plastic surgeons, and a lot of plastic surgeons did do this for a while until they started realizing that people had balloons that were eroding through their stomach.
Yeah, I was like, how's that safe?
It's just, and it's like, it's not a permanent solution to weight loss. Like you're not going to have a balloon in your stomach for the rest of your life. And I think the fact is that, anybody in medicine should understand, and people even not in medicine understand that if you've got weight issues, these are issues that for most people, they deal with all their life.
Yeah.
And just to say, oh, hey, I've got the fix for you. That's this injection, or I'm going to have you swallow a balloon. Like, are you truly doing them a favor by doing that? Or are you basically making money off of them temporarily until they go to the next thing?
Yeah.
I saw a plastic surgeon on social media who does these injections, and he compounds them, meaning that he doesn't do it with actual Wegovy or the actual medication. He hires a compound pharmacy. He buys it from a compound pharmacy, and then he charges his patient cash for it. And then because it's compounded, it's made individually, technically, for each patient, and you can claim that, oh, you have something different than the next one and stuff like that. And part of that also is a reason that you have to go back to that same doctor, because you can't just have your family doctor prescribe it for you or something. And then somebody asked him, like, well, what if I don't want to be on these medications, And he said, it's fine. Just be on them for the rest of your life. That was his explanation.
That's terrible.
So my feeling with these medications, I think they're awesome for the right people. But if you are offering these medications, these injections, but you're not offering them lifestyle assistance, dietary assistance, all that type of stuff, then what is really your reason behind doing this? Are you truly doing this for your patient, or are you doing it for your pocketbook?
Yeah, definitely.
And my argument is, if you're a plastic surgeon and you're doing this, and you don't have a team that includes like a nutritionist, that includes possibly a therapist, maybe a life coach, then you're doing this for the money, and shame on you. Like, it's not the right thing to do. Yeah. Okay, so a lot of talk about the GLP-1 agonists, and I think overall they're a good thing. And I think that they can help so many people, but it's understanding, I think, who should do this for you. And I would encourage you, if you're getting these injections, to see either your primary care doctor or see an obesity specialist, somebody who just specializes in weight loss, because they're hopefully going to help you with more than just let's inject you, but let's help you make lifestyle changes so that maybe someday you can go off these medications and still feel and look great and be healthy.
Maintain it.
Yeah. Okay, the next one that made news at the aesthetic meeting is Mentor's Breast Implant Simulator app. Mentor's new app, the Mentor Breast Implant Simulator, lets users visualize potential breast augmentation's outcome through augmented reality. They can upload photos or use real-time video to simulate various implant sizes and see how they would look. The app also offers educational content on breast augmentation and connects users with local surgeons. It allows you to share simulated results with your friends for feedback, engaging patients earlier, and providing a personalized experience for those considering breast augmentation. Do we get calls for people asking about simulation? Like, can we simulate how their breasts look?
No, never.
No?
I think it's kind of fun though.
I would think it's
helpful.
kind of, so we used to have a device called the Axis 3D, and this I got maybe 16 to 18 years ago or something. Like it was like big deal. And it was in my office for many years. There's another one that was its competitor, and I'm blanking on the name, but it's the same company that does the Vizia that we have that looks at the high definition on the face. And so there are these devices that have been around for many years that simulate breast augmentation. So obviously you take your top off and it has numerous cameras that capture you from like a quote unquote 3-dimensional view. And then you can put in different implant sizes as a way to look and see how it would look. And so I bought this device at the time, like I said, it was maybe 15, 18 years ago. It was like $30-some thousand. And we used it for many years. And then the company went out of business because there was literally 2 major companies that did this. And the other company got bigger and bigger. And then this one like just folded. And so I had this device that cost me, like I said, it was like $30-some thousand, and we were still using it. And then gradually, like, there's no support for it. And it was on my old computer, and I think the computer still had like Windows 98 or something.
Oh, gosh.
And it got to a point where the computer was so old and we couldn't update it because the company was out of business, but we had this huge device and it was still working until finally, and I couldn't switch the program to a new computer because I didn't have the disk or anything to download. It was just, they put it on the computer. And finally, the computer just croaked, and then I threw the whole thing in the garbage. And so we used to have a simulator app, but now a simulator in the office with this big device, and now they came out with this app, which is awesome, I think, for people. Breast augmentation is still the #1 cosmetic surgery throughout the country, and so I think this can be very helpful for people to see what they might look. I think the important thing we have to realize too with this, hopefully too, is it can help people see maybe asymmetries that they don't realize before.
Yeah.
Because we get patients who come in and they've got one breast that's a lot larger than the other, and sometimes surprisingly they don't never notice it. And so I try to point out to them, or let's say they have a nipple higher than the other. It's nice to have something like this where they can actually see it from a more objective standpoint and be like, oh yeah, my breasts are a little bit different. And that's normal if they are, but to get an idea of what they would get afterwards.
Yeah, I think it's helpful too, because if they weren't sure if they wanted it, they could look, and then it's like, oh, I don't actually like that. So like they're saving money and time as well. So like they're not like spending so much money.
You could do this before you go see a surgeon, before you pay for a consultation, and be like, oh yeah, maybe I don't like it. Or you can come in and be like, hey, I kind of like this size already, because how many patients come in and like, well, what size do you want to be? And they're like, well, you choose for me. And like, well, I don't know what you want. Like, what do you think you want? And so anything I think that puts control into the patient's hands and gives them more education and ability, I think is a good thing.
Oh, yeah.
Okay, so let's move to the next one. Oh, is this something I'm sure you've gotten calls on? Deep plane facelifts. A key topic of discussion was a growing popularity of the deep plane facelift technique. Dr. Fazelifts recommends that anyone interested in this procedure should consult with a board-certified plastic surgeon, emphasizing that while deep plane facelifts might be more complex, they can deliver superior results in the right hands. However, he cautions that the technique isn't suitable for everyone, reinforcing the need for thorough consultations and individualized treatment plans. So do you get calls on the deep plane facelift?
I have before, yeah, and I didn't know what they were talking about. I was like, no, he just doesn't
shows how much I educate my employees at so this is something that I've talked with Renee, who's my patient coordinator, who talks to the patients after the consultations. And I think I've talked with Megan about it a bit too, who's my other front desk person. So the way to describe it, I mean, every surgeon does a facelift a little differently. There are some surgeons traditionally who did what's called a skin-only lift, where they just remove skin. There's a muscle tightening lift where you remove the skin and you tighten up the muscle underneath. There's a lot of different ways to tighten the muscle up. Sometimes you literally remove a strip of the muscle and then suture it up. That's called a mastectomy. You can do application, where you basically just suture it up into a higher position. There's all these different techniques that people have used over the years. The deep plane technique, essentially, the best way to describe it is instead of lifting the skin and the muscle separately, so normally you would lift the skin and then do something to the muscle to tighten or lift it, you would kind of dissect underneath the muscle and lift the whole thing up kind of as like one piece.
Okay.
So it is, and that's why I call it deep plane, because you dissect kind of deeper, like below the muscle. In order to do that, you have to be very careful because there are a lot of nerves there, and these are the nerves that power the muscles of your face. And so there was a doctor, and this is not, deep plane facelift is not a new technique, okay? There are people who advertise, oh, this is new, and no, it's been around for decades. There was a doctor named Sam Hamra who lectured on this. I mean, has done it, I think he's retired now, so he's been doing this so long, like he's retired, like it's been that long that it's been around. And so it's something that I did not necessarily learn in my training, because where I trained in Beverly Hills, the plastic surgeon that I trained with was known for somebody who it's like, hey, let's do less invasive technique but get really nice results. So we get people healing fast, low risk of complications, and we get them looking good quickly. Because that's kind of like the Beverly Hills idea, the Hollywood thing is like celebrities don't want to be. Like if you're like, hey, we're going to inject your face full of fat and it's going to be 3 months before you look good, like that ain't going to work in Hollywood. That might work in New York City because there are surgeons who do that type of thing. But in Hollywood, the idea is that you got to look good quickly, and that, you know, when I was out there, literally they would be under surgery and like with a facelift, and as you're wheeling them out to their car, they're looking in the mirror already. And like,
oh my gosh.
Yeah, it's a whole different deal. So the deep plane lift is an idea started by Dr. Sam Hamra, where you dissect real deep and you elevate everything in one big piece. And the hope is that you can get a longer lasting result. Okay. And the fact is, when there were some studies that compared the deep plane facelift to other more traditional techniques, and did find that when you're 15 or 20 years out, you may have a little less recurrence of the looseness there. But when you look at it 5 or 10 years out, maybe not so much. You know, they're pretty darn comparable. And the other concern is that there can be a very high rate of complications. Because you're dissecting below that muscle where all the motor nerves are, you can ding those nerves, and now you've got a crooked smile afterwards, you know, and that type of thing. And then the recovery is bigger because you're dissecting deeper, and so you're going to have more swelling and stuff like that. So in the end, I think that there's no consensus of like whether everybody should do a deep plane or a different type of a technique. I don't do a deep plane. I do what's called application, mass application, where we do elevate and tighten the muscle. If you are looking for, you're like, hey, I'm 45 years old and I'm only going to have one surgery in my lifetime as a facelift. You know, should you do a deep plane? I mean, it might last you longer, so there is that argument maybe. But otherwise, you know, if you're in your 50s, 60s, or 70s, is it really worthwhile to do something quite so aggressive? Yeah. And so that's kind of how I talk to patients about it. Everybody has their own technique. You know, you may get a little longer lasting result, but you also may have a higher risk of complications.
If you were trained in it, would you do it, or do you still just prefer what you do it?
So I've been very happy with how I've been doing it. It's how I was trained. I trained in Grand Rapids with some really good plastic surgeons there who are very conservative, and then I trained out in Beverly Hills, and it's kind of a combination of both techniques is how I've been doing it, with little modifications along the way. So I don't feel the need to change my technique when I've overall been very happy with what I've been doing. They say that the week of the year with the highest complication rate in plastic surgeons is the week after the annual meetings, because people learn new things and they try them on their patients and they develop complications because they've not done it before. And so, yeah, I mean, I'm all for innovating and, you know, trying new things if they're going to definitely improve the patient's experience or their outcome. But at the same time, like to completely do something new, you know, that's a tough one, especially if you're not sure that they're going to get even a better result or a longer lasting. It's arguable. So, okay, the next thing that's big in plastic surgery are BBL reversals. Marietta, Georgia plastic surgeon Stanley Okoro has seen a growing trend of reversing Brazilian butt lifts to correct exaggerated or disproportionate results. People are almost undoing what was done a few years ago, he says, as more patients seek to reduce their BBL enhancements to achieve a more natural look. His technique involves removing excess fat through liposuction and then reshaping the area to maintain a more balanced silhouette. So is this basically just plastic surgeons being like, hey, let's inject a bunch of fat in your butt, and then a few years, hey, let's just take it out? Yeah, never mind. I don't think that there's as many of these going on as people claim. I think this is another thing where people are trying to make more news of it. I think some of this is Ozempic thing, is that people are losing weight and their butts are getting smaller naturally. The big question is, comes down to Kardashians.
I was just about to say.
Do you think that Kim's butt has gotten smaller?
It's hard to say. I don't know. I feel like her waist has gotten smaller, so it's kind of hard to say what has changed. I think Chloe's has. Yeah.
So then the question is, has she had a BBL reversal, or is it that she's just gotten thinner because maybe she's on Ozempic or something?
Right.
I don't know, but I feel like the issue if you liposuction the butt, though, is some people think if you liposuction the butt, it's going to make the butt nice and tight and smaller. And that's not true. If you liposuction the butt, it causes the butt to basically sag, like you deflate it. It's like a deflating balloon. Now, if you're in your mid-20s and you lipo it and you don't take a lot out, could that skin retract? Probably. But as you get older, the skin isn't going to retract as much. And the more fat that you remove, the more that butt can sag. And so you got to be really careful with these BBL reversals because who knows how that's going to look in the end. Okay, so one final one from the meeting, and this is a treatment that I have been following for a while. It's Renuvion as a surgery enhancer. Renuvion is a surgery enhancing tool that many plastic surgeons are using for its skin tightening capabilities. Grand Rapids plastic surgeon Dr. Bradley Bengtson, who's a good friend of mine, finds it especially useful for intro procedures like liposuction, where it can achieve 25 to 30% skin tightening, adding that it has a combination of internal and external applications. However, Dr. Bengtson warns of risks associated with its high heat, stating that improper use can lead to burns or other complications. Do you get a lot of calls from people who want non-invasive skin tightening? They're like, oh, I don't want to have surgery, but I want my skin tighter.
Yes, a lot of them.
Then what do you tell them?
Well, that you only see them for like surgical stuff. So if they wanted something like that, they could see like the esthetician, but it's like, he's not going to do, I don't know. They're always mad whenever I say, so it's like, I don't know.
Like, I don't know.
Can't really give them a good answer.
And I think you can't because it's tough. Like there is no really good non-surgical skin tightening treatment. And I think that that's an important thing. And so like for the face, we have Morpheus 8, which is nice, but there's arguments that it doesn't tighten up the skin much at all. And I think it really varies per patient. I do think you can get some mild skin tightening with it, but it has to be in small parts of the body, So if you get a little bit of skin tightening and you do it in your neck, that can be noticeable. But if you're trying to tighten up the thighs or the tummy where it's a much larger area, you're really not going to see nearly as much because you need to have technically much more skin shrinkage in order to really notice it versus, let's say, in a small area like underneath the chin. Renuvion is one that's been around for many years. We actually had it here in the office. We tried it on. This was before you worked here. And we had a luncheon and they showed us the device. And it was scary, actually. It uses this like plasma energy where it almost looks like there's like, it almost looks like a little flamethrower at the end.
Oh, gosh.
Yeah, it was crazy. And the idea is that if you put it underneath the skin, it creates heat and causes the skin to tighten up from the inside. And so you can technically do like a Morpheus 8 RF radio frequency on the outside of the skin and do something like this on the inside. Now you're really double heating the skin. And the idea is that you get the collagen to a certain temperature and that collagen will then tighten. And the idea is really shrinkage of that skin. But the question is how much tightening do you get? And unfortunately, the answer is every patient is different. Whenever you undergo any type of like light-based treatment, heat-based treatment, you're relying on your body to react to that treatment in a certain way. And some people may be more aggressive responders than others. And that's the issue with Renuvion. Renuvion, when I first looked at it, I was afraid to use it because I'm looking at this, I'm like, dang, that looks scary. And my biggest fear is to cause a burn on somebody.
Yeah, that's kind of scary.
And at the time, it didn't have enough safety precautions. Like basically they said, you put it under the skin. It has this, it literally looks like it's like it's kind of like it almost looks like electrical energy but it's like a cross between that and actual like a flame. It was crazy looking. And at the time, they said you would prevent burns by taking what is essentially a thermometer, an external thermometer. Like if you've got HVAC issues and you're like measuring how the temperature of the air coming out of your air conditioning, and you have the little gun, like they use that, and then you put that on the surface of the skin, and you'd have like your nurse always having that thing on the surface of the skin, and then you're running underneath, making sure that you don't burn the skin. It just was like, I don't know. It looked scary to me. And the last thing I ever want to do is
experiment.
Yeah, and the last thing I want to do is burn a patient. Like that'd be a disaster. So I'm like, yeah, I'm not using this because I think it's too dangerous. And now it's been several years, and there are a number of plastic surgeons who have it. I do think that there are more safety precautions in there. And it right now, I think of all the non-surgical, or it's surgical though, it's just minimally invasive, I guess, is a way, but you have to have surgery done. You need anesthetic solution, stuff like that you have to inject into it. It's probably the best non-cutting, I guess, tightening that there is from what I can tell, but it still looks a little scary to me. So that's Renuvion. So we're going to shift gears now and talk about some celebrities who've been in the news lately about their plastic surgery. Have you looked at Ben Affleck? He showed up at the I think it was a Tom Brady roast. And then people were talking about how they thought he had plastic surgery. Did you take a peek at him at all?
Yeah, he looks good. I don't know how old he is. Maybe, is it like 50 something, in his 50s? He looks really good regardless of his age.
I think he's in his 50s. I feel like he's still in his 40s.
Really?
52.
Oh, he's like my age. I'm actually a year younger than him.
He looks good. You do too. You both look good.
It's because I've had a shitload of work done. No, I'm kidding. So I don't know. Did you think it looked like he had like Botox or filler or anything?
Yeah, maybe a little bit. He's too smooth. Everything is too...
Yeah, I thought everything looked really smooth too.
Yeah, it's like kind of suspicious, but
he
looks good no matter what.
It's sus.
Looks very nice.
Maybe it's that olive oil, secret olive oil recipe that J-Lo's giving him. Since J-Lo says that's why she looks so good, is her olive oil. Drake has made a lot of news with his feud with Kendrick Lamar and Rick Ross and Metro Boomin. And I don't know who else. I don't know if Taylor Swift is somehow involved. I think somehow in that too. But so they're accusing him of being a BBL drizzy.
Yeah.
So I made a video about him, whether he's had a BBL. And some people try to correct me saying, they're not saying he had a BBL. They're just making fun. Like BBL means just plastic surgery.
Yeah.
So I don't know. That's what they're saying. I don't know if that's what he means. So first question, do you think that Drake has had a lot of plastic surgery?
I don't think so. To me, I think he looks pretty natural. Like if you compare to how he used to look on, what was that one show he was on? Degrassi? Yeah. He was younger then, but like he still looks pretty comparable. I don't think he's had anything extensive done, if he has had anything.
I'm not sure why there's this why they're so making fun of him in plastic surgery. I agree. So I took a look at his nose before and after, and I don't think he's had a nose job. Like his nose looks the same. And the nose changes as you get older and stuff. It doesn't look like he's had anything, definitely done to it.
Yeah.
And then the question is, do you think he's had a BBL?
I mean, I don't think so, but I guess I've never really looked hard enough.
So the thing with a BBL is you got to harvest fat from somewhere and inject it into the butt. And he is too lean.
He has no fat.
Yeah, so I don't. If he had a BBL, it didn't do anything because he has no fat. And even if you do a BBL, essentially what you're doing is you liposuction fat from. For a guy, it's going to be the abdomen and the hips, the love handle, essentially. Then you purify the fat, inject it into the butt. And about half the fat, maybe a little bit less, will stay. So now you've got to consider, you got a liposuction, only half of it's going to stay, and you got to split up between two butt cheeks. So there just isn't much fat there at all. And so if he had a BBL, then you can't
waste of money.
Yeah.
If he did.
The one question I have, and I do think it's possible, is ab etching. So there's a question of whether his six-pack is real. What do you think? Do you think Drake's six-pack is real or fake?
I feel like in some pictures it looks very fake, but some pictures it looks real. So I don't know. Maybe. I would say maybe.
Yeah, I got to think that all of them are making fun of him of having plastic surgery, that there has to be some truth to him having had something done.
They must know.
I mean, they're, because it's like, why would everybody be talking about it if there's like zero truth to it?
Yeah.
Like maybe he hasn't had a nose job or a BBL, but maybe he did have. So in order to get a fake six pack, it's called abdominal etching or high definition liposculpture, where essentially what you do is you liposuction along what we call the tendinous inscriptions. And so we all have two paired muscles that come straight down our tummy called the rectus muscles. And these are flat muscles that have these tendinous inscriptions that can give people a six pack. And the tendinous inscriptions are basically just tendons that run between kind of these groups of muscles, the six packs essentially. And so the way you can actually accentuate that in somebody is if they've got like kind of a layer of fat on top of all those muscles, you can't see them. And the way I describe it, it's like if you've got like a winter coat over like, these ripped abs. Well, you can't see those ripped abs. You got a winter coat over it. You got to take the coat off. And so what high definition liposculpture or abdominal etching does then is it liposuctions along those edges, essentially along those tendinous inscriptions to try to accentuate that. Now you can liposuction the whole thing, but then you really also focus on those inscriptions to try to create those indentations that would normally be there. But essentially what you're doing is you are reshaping the fat to look like muscle.
Wow.
And it can work. My argument with this, and I don't do it myself so much, is like, okay, it may look good when you're in your 20s or 30s, but like things sag as you get older. So like, how's that going to look when you're in your 50s and 60s? Is that like six pack going to start drooping and like kind of sagging to like into each other? And like, what's that going to look like?
That looks so gross. I'm so sorry.
Yeah, and the treatment hasn't been around long enough that we're like, oh, hey, here's a 20-year, retrospective analysis of people who've had abdominal etching. Let's see how it looks. Like, no, it's all like, hey, this is how they look a year later or 6 months later. And so how do you tell if somebody's had it done? Well, very simple. The best way to tell is if they're like kind of flabby everywhere, but their abs are nice and ripped, then that is one good way to tell. Like, I mean, if I had a fake six pack, you'd never be able to tell because I'm ripped everywhere else.
Yeah,
so it would be obvious.
Yeah.
But like you take somebody like Dr. Charles Lee, or Dr. Ricky Brown or Subio, and you give them a six pack, well, it'd be pretty obvious.
Yeah.
You're like, dude, you're flabby everywhere else, but now you got this ripped six pack, and that's how you tell. And so that's what people are looking at with Drake is like he's had photos where it looks like he's got a pretty defined six pack, and it's not like he's in bad shape. I mean, he's lean, but is he like really ripped everywhere else? Like you would think then he'd have a lot of definition elsewhere.
Yeah.
So I don't know. It's a question. Okay, so how are we doing time-wise? Okay, we got just a few minutes. Let's go through a couple of really kind of interesting things that are going on social media before we cut it loose here. Okay, so there was a video claiming that urine is the same thing as urea in skincare.
Brother,
And this video came from a very prominent podcast called the Social Media Hour, I think is the name of the podcast, where a guy basically said that he applies urine to his face because urea is used in skincare and urea and urine are the same thing.
No, God! No, God, please, no! 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 No!
Would you date somebody who uses urine as his skincare?
Not unless you gave me like $10 billion.
Would that be what do you call it? I mean, that would be a definite no. Like that would be a deal breaker.
I will
like
pass.
you meet somebody through Match.com or wherever the young people are meeting people at now, and you're like, did you need to go there? Were you sitting near the toilet or something? And he's like, no, it's my skin. Like I use your. Would you like date would be over?
Oh, I'd be so grossed out. I would just leave. Thank you for your time. I gotta go.
So this is funny because this guy supposedly uses urine as skincare because yes, if you do look at skincare products, urea is often a prominent ingredient in certain skincare products. And so there is this belief that urine and urea are the same thing. So, but it isn't. And so urea in skincare products is made in a lab and actually is a really good moisturizer of the skin. And there are even certain skin conditions where urea can really help with it to really soften the skin up. But urine contains urea, but also contains a lot of other stuff too. And that's the difference. And so definitely do not use urine as your skincare. It's not the same as urea. Okay. So should you change your pillowcase for better skin? Question for you, Des. Do you ever go to sleep with wet hair?
I have before, I will admit it, but now it's like not good for you from what I've heard. So now I try not to.
No? Do you know why it's not good if you sleep with wet hair?
I mean, my mom always told me it's just because it's going to get all naughty. I don't know if that's the actual scientific reasoning.
Is that true though? Does it get all naughty?
For me, it did, yeah.
Okay, and so it's better, even if you brush it before you go to sleep if it's wet? Oh, interesting. So my daughter, who's got like really long hair, she'll go to sleep with wet hair quite a bit. So the reason why I'm not one, and I break this rule myself more than I'd like to, but the reason behind actually not going to sleep with wet hair and its impact on your skin is that wet hair at night, it gets warm. That's a breeding ground for bacteria.
Okay.
And so if you've got a pillowcase, the pillowcase gets wet and your pillow gets wet, and it's not, you can wash your pillowcase, but you're not really washing your pillow.
Yeah.
And so you can get bacteria then that eventually grows in to that, and it can become kind of a breeding ground for bacteria. Now, if you've got acne issues and you're going to bed with wet hair and you're not, especially if you're not changing your pillowcase regularly, even if you are, does that bacteria and stuff get through that pillowcase to your? So that's the big thing is that, could you potentially be worsening, let's say, breakouts because you are creating this bacterial growth on your pillowcase? And especially, people who don't change their pillowcases regularly. How often do you change your pillowcase?
I wash my sheets like every week and a half just because I like
That's
clean
good.
stuff.
When I was in college, my roommate, I swear to God, we were in quarter system, so you go 3 months. He didn't change his pillowcase all 3 months. Like, it was the same pillowcase for 3 months. And I venture a guess that if you go to colleges across the country, especially dudes, like half the guys wouldn't change their pillowcase, like at all, like during a quarter, then unless like their parents came and forced them to do it. Like I think half. So yeah, so I think that, so for me, I do go to bed with wet hair sometimes. Like if I work out in the evenings a lot, just because, like I have surgery in the morning or I have patients. I don't like to get up early to work out. Do you work out in the morning? Or
I do before I come.
Yeah, I can't. Yeah, it's too much. I don't have the wherewithal to get up early to work out. So I always work out after like around 8 or something. And then I shower, and then by the time I go to bed, sometimes the hair's still a little wet, so that's not my thing. But we change our pillowcase maybe once a week, so that's good. Actually, my wife changes it once a week. I help sometimes.
I heard like silk pillowcases they make a difference somehow. I don't know if that's true or not.
So if you are the type, so if you lie on your back, that's not a big deal. If you are the type that like scrunch your face into your pillow and you create these sleep wrinkles. So if you wake up and every morning you wake up and you've got sleep lines in your face, those will get etched in after a while.
Okay.
And so the idea really, and I'm a fan of this, although I do not have silk pillowcases because I don't tend to scrunch my face. But the idea is that silk and satin is going to be more slick. And so you're going to get less of that face scrunching.
Okay.
And so you get less of the sleep wrinkles or pillow wrinkles afterwards, and it may help to prevent them as you get older.
Okay.
So yeah, if you're listening to this podcast or watching it and you're like, yeah, I really am completely scrunching my face, and I wake up in the morning, there's these vertical lines on my face, then yeah, switching to satin or silk is probably a good idea because you may prevent those lines from, getting etched in long term.
Okay.
Well, thank you so much for joining me today.
Of course. Thanks for having me on again.
So we are going to try to do some of these fairly regularly to